Welcome back to Your Life. I'm Dr. Anna Marie. You know, every year in our country, almost 1,000 men are diagnosed with prostate cancer, and almost all cases are treated with either surgery or radiation treatment, which are associated with side effects and, in many cases, a poorer quality of life. Well, as you'll see on this week's Your Life story, Steve Hyenson shares with us how he decided to take on this disease.
I actually thought that if I had surgery, my quality of life could get worse.
3 years ago, Stephen Hyenson was shocked when he found out that he had prostate cancer.
Hi.
Nice to see you.
Same here.
Come in, have a seat.
Okay.
It was his shock and fears from the debilitating side effects of surgery or radiation that motivated Stephen to have a long talk with his family and doctors. Since he was dealing with a localized, low-risk form of prostate cancer, Stephen made the choice to follow a plan of active surveillance.
The hardest part is mentally, and if you can get by that you have a little cancer and it's low grade and you're checking it every 3 months, that's a great thing.
In the era of PSA screening, we know that about 60% of men don't actually need to be treated for prostate cancer. Active surveillance is a recently developed strategy of close monitoring. They aren't treated initially, so they get serial blood tests with a PSA, physical exams, and biopsies. If it looks like the disease is behaving more aggressively, they're taken to treatment at that point.
Dr. Julia Hayes and her team at the Dana-Farber Cancer Institute created a computerized model of 100,000 hypothetical 65-year-old men newly diagnosed as having localized low-risk prostate cancer. They either received treatment or a strategy of active surveillance.
Men who pursued active surveillance had a better quality of life overall, on average, than men who were treated initially. The hope is that this approach allows us to follow them and not treat them potentially forever, and yet capture men who have more aggressive disease.
I consider myself very lucky that I have this option to wait it out.
What this study provides is a starting off point for an important discussion between physicians and patients.
As for Stephen, he's just happy he took the time to talk with his doctors. He's now enjoying his freedom years of retirement.
My quality of life is great. I mean, I recently retired. I joined a gym. I watch my diet. I get a tremendous amount of exercise. I do things that I've never done before as far as leisure time, which I never had in my life.
We want to thank Stephen for sharing his story with us. I also want to point out that researchers involved with the study point out that whether you pursue active surveillance or immediate treatment, it really comes down to personal choice. So be informed and talk with your doctor. We'll be right back.